Imagine a pain so severe, so excruciating that some people call it a suicidal disease. Yes, it's true. When there was a situation, people are compelled to do suicide because of this disease. Remember, it's not the just headache or a dental problem. This is a nerve disease which is known as the trigeminal neuralgia. Everyday acts like speaking, eating, chewing, or sometimes in severe situation, even a gentle breeze of air can cause excruciating pain. Here's the big question. Can this pain be cured? Can these patients can see a good life? Today in this video, I am going to answer these questions. I am Dr. Devjyoti Datta, a pain physician from Kolkata. Trigeminal neuralgia is a rare but devastating condition affecting the trigeminal nerve of the face. Trigeminal nerve is supplying in both sides of the face. There are three branches. One branch supplying towards the eye, that is known as the ophthalmic branch. One branch supplies towards our upper jaw, that is known as the maxillary branch, and one branch goes towards the mandible, that means our lower jaw, that is known as the mandibular division. This pain goes into one or more divisions of the trigeminal nerve. Today's goal of presentation is to raise awareness about the misunderstood disease but common myths about it and symptoms, and we'll explain why it is called the suicidal disease, and we'll discuss what are the latest treatment options which are available for this disease. What is trigeminal neuralgia? Trigeminal neuralgia is pain which is originating from the trigeminal nerve. It is supplied in one side of the face. The pain is usually electric shock like, lancinating, sometimes it is described as a stabbing, or sometimes it is also called electric shock like. Attacks can form in a second, or sometimes it may last up to few minutes. Sometimes these attacks come successively and pain is so severe that it is really unbearable for the patient, and it triggers in small activities like brushing the teeth, chewing, smiling, or even touching the face, or I have already told in severe cases, even the blow of the air coming from the fan, that could be even painful. The severity of pain leads to some of the patients to commit suicide in past. Patients live in constant fear of the next painful attacks. The emotional toll includes depression, anxiety, as well as the social withdrawal. Many suffer for years before diagnosis, making life unbearable. And fortunately, the modern treatment has changed the scenario and giving the hope to the patient. Now coming to the symptoms. Main symptoms includes sudden sharp or stabbing pain in one or more divisions of the trigeminal nerve, that means either above, below, or here, and it is one side of the face and triggered by mild activities. Most commonly, it happens over the age of 50, and female patients are usually more prone to develop this disease rather than the male patients. But sometimes it can cause in younger adults as well. Sometimes it is misdiagnosed as a dental pain, and even we got patients where actually it was thought to be a dental pain and for which tooths are extracted, and then also the pain is not recovering. Then the patients are sent to the pain physicians. Now coming to the treatment options. When the disease is diagnosed, usually we start with medications. I am not going into the brand name or the dosage of the medications, but there are some medications which are mainly in the anticonvulsant group, like carbamazepine, which is also known as the drug of choice for the disease. So we have to give the medicine according to the patient's situation, comorbidities, age, as well as the medicine's reaction to it, because sometimes the carbamazepine really have a allergic reaction to the patient. Apart from this, there are few more medications that's also sometimes helpful. Now coming to the minimally invasive spine or pain intervention. So this is the pain intervention what we are going to do. That includes doing an intervention close to the origin of these nerves, that is near the Gastrin ganglion. Previously, there was techniques which are known as the glycerol rhizolysis. That means with the glycerol we are going to the ganglion and we are in a special technique under fluoroscopy injecting this glycerol close to the Gastrin ganglion at an area known as the trigeminal cistern. This is called the retrogastrian injection of glycerol. But nowadays, the most commonly done procedures includes the radiofrequency ablation, which is putting a needle close to the trigeminal ganglion and then applying the radiofrequency current to it, which actually causes heat there. The heat is precisely controlled so that it should not damage any other nerves, but it helps to relieve the pain of the patient. There is also surgeries for that. Among the surgical solution, there are microvascular decompression, which relieves the pressure on the nerve, and it is mostly suited for the young patient. There is another technique for the patients, which is also an intervention or MIPSI, we can call it, that is known as the balloon compression. Now, in the balloon compression, technique is close to Gastrin ganglion radiofrequency ablation, but in this technique, one balloon is inserted close to the Gastrin ganglion and then it is inflated for some time there. So, with the pressure effect, the pain is relieved. Remember, balloon compression is especially useful when the pain is close to the eyes, that means ophthalmic nerve is involved. Why? Because there is a side effect of the trigeminal nerve radiofrequency ablation, that sometimes there is a little bit of motor deficit and as well as some sensory deficit. The sensory deficit is usually more with the radiofrequency ablation, whereas the sensory deficit is low for the balloon compression. So, if the ophthalmic division is involved, balloon compression gives an advantage that in this area, post radiofrequency or post intervention hyposthesia, that means loss of sensation, decrease in sensation, that do not occur, because if the sensation of the eye is decreased, that can actually sometimes cause a, I should say, ulcer in the eye, that is known as the exposure keratitis. If you do balloon compression, the chance is less. But in most of the other cases, we usually selectively with the radiofrequency, we block the specific nerve that is actually helpful for the patient. There is another approach also that is not invasive, that is known as the gamma knife therapy, that is also is a alternative to this technique. Now coming to the final question, can we live with the hope that this will actually go? Although the condition is painful, but the hope exists. Early diagnosis greatly improves the treatment success. Many patients regain their normal life, and with proper therapy, they can do all their daily activities and functions. Counseling and family support is crucial for the coping with such a situation. And trigeminal neuralgia doesn't mean the life ends. It doesn't mean that patients need to commit a suicide. That it actually is having right treatment and right support, then the patient can live a normal life. Now the big question, that if this unbearable pain is cured, the answer is yes. Many patients do achieve a long-term relief. Some live pain-free even without medicines. Some patient takes a little or a few medicines in a day and they are actually benefited. And definitely treatments needs to be individualized. And for this, you need to visit a pain physician, and under the pain physician, he can guide you to the exact treatment what is required for you, and they can treat your condition. Let's end this discussion with this message that trigeminal neuralgia, though is a devastating condition known to mankind for long, it's an excruciating pain condition, but now we have a treatment for the trigeminal neuralgia, and with correct treatment under a pain physician, you can actually be leading a normal life. Thank you.